So good morning to all. Today we are dealing at another topic that is very interesting, not only for those who are associated with nursing or medical profession. It is interesting for the public also because of the terminology, because of the signs and symptoms that we may come across while associating with this type of patients. It is a personality disorder. The word personality is using in different ways, different connotations, and no one exactly know what this personality is. Because we can see people use this word in different contexts, which is actually not the personality, like to describe appearance, describe behavior, for describing certain character, for describing certain traits, for referring motivation. While seeing a person with a highly motivated, his personality is excellent, like that we may say, people used to say. Then in certain situations like values, cultural values, if person has some cultural values, we may say it is because of it is the personality. No. Then interest, cultural attitude. So these are the some of the areas where this word personality uses without knowing exactly what it is. So before learning about the personality disorder, we must be able to pinpoint exactly what is this personality. Different ways of defining personalities are there. One of the important definition by Alport is it is a relatively stable and enduring aspect of an individual which distinguishes that individual from others. Two things. One is unique, second one is enduring. So constantly occurring, unique one, which differentiate one individual from another, or which decides how a person react to internal or external stimuli. That is personality. So it should be a relatively long lasting one, it should be unique one, that will be able to differentiate one individual from another individual, or it should be able to explain how an individual is reacting to internal or external stimuli or its environment. That is what is personality. And we learned a lot of theories related to personality development. Initial classes we discussed about psychosexual theory by Sigmund Freud, psychosocial theory by Erik Erikson, learning theories, cognitive theories, moral theories, cultural theories, object relations theories. All these theories explains about how personality is developing. Now we can move on to personality disorder. That is little bit complicated, and its definitions goes like this. It's the enduring subjective experience and behavior that deviate from cultural standards. Here also that is the enduring, long lasting experience or behavior that is deviating from the cultural standards. When a person is living in an environment, in a society, he has to obey the cultural standards. If the behavior or experience of that individual is deviating from the cultural standards, that indicates the personality disorder. Moreover, it is pervasive, that is awkward, and onset usually seen in adolescent and young adults, and it is stable through time and leads to unhappiness and impairments. That is very important. So I will repeat once again. Personality disorder is enduring subjective experience and behavior that is deviant from the cultural standards, considerably pervasive or rigidly pervasive, with an onset in early adulthood or adolescence, and stables through time, long lasting, and it leads to unhappiness and impairment in that individual. That is personality disorder. Now we learn what is personality, what is personality disorder. One more terminology you may have to remember with this personality disorder, that is personality trait. Predominant feature of a personality is the personality trait. That means a person can have certain predominance, so many characteristics he can have, and there will be some predominance among these characteristics. That predominant feature of a personality is the personality trait. When this personality trait is causing problem for the individual, for the family, or individual life, family life, or social life, you may call it as a personality disorder. Examples of personality traits are paranoid personality trait, schizoid, schizotypal, histrionic, avoidant, anxiety, anxious. So these are some of the personality traits that you may can see in personality disorder, or when it becomes abnormal, it is a personality disorder. Now we can see the prevalence of personality disorder. It is more commonly seen in males, that is antisocial personality disorder, schizoid personality disorder, paranoid personality disorder are more commonly seen in males, whereas histrionic personality disorder, anxious personality disorder, borderline personality disorder, then dependent personality disorder, these are some of the personality disorder more prevalent among females. Age of onset, in its definition itself I said it is adolescent and early adulthood. So if these features seen in a person in an early developmental stage, we cannot say it's a personality disorder. It can be associated with the normal childhood behaviors or traits. Then among this personality disorder, anxious personality disorder is the most commonest one, that is 44%. Among the personality disorder, 44% of 44% is anxious personality disorder. Borderline personality disorder around 18.7%, paranoid 0.7, dependent 1.57, antisocial 2.5, and histrionic 6%. It varies, and considerable variations are there in developed and developing countries. Prevalence of personality disorder is around 10 to 13% in developed countries, compared to 1 to or 0 to 3% in developing countries like India. So there is some cultural social influence on this personality disorder. Wide variations are there related to personality disorder. Now we can move on to etiological factors of personality disorder. Various etiological factors are postulated, and few are the important one we can discuss now. First one is biological factors. In biological factors, it is commonly seen genetic predisposition, that is genetic predispositions are there for personality disorder. It runs in family. Then of course another important biological factor is neurochemical factors. In neurochemical factors, it is found that abnormal amount of serotonin is seen in individuals with a personality disorder. Then another important etiological factor is psychosocial factors, that is social and psychological factors, that psychological traumas one individual experienced during childhood can precipitate personality disorder in later life. Then of course socio-cultural factors, I already told you it is highly socially bound one. Cultural influence are also influencing. So that is all about etiological factors of personality disorder. Now we can see classification. There are mainly two types of classification. One is ICD classification, and next one is DSM classification. And few differences are there with respect to terminology in ICD and DSM. And in ICD, this personality disorder comes under F60 to 69. Among that, F60 is specific adult personality disorder. F60 to 69 are disorders of adult personality and behavioral disorder, and F60 is the personality disorder. That is, X60.0 is paranoid personality, 60.1 is schizoid personality, 60.2 is dissocial personality. That you may not be seen in DSM. There you may get another terminology, that is antisocial personality. 60.3 emotionally unstable personality, 0.4 histrionic personality, 60.5 anancastic personality, 60.6 anxious personality, 60.7 dependent personality. If you remember some of the film characteristics while learning this one, it would be easy for you. For example, paranoid personality disorder. If you can remember the character played by Suresh Gopi in that movie Deshadanam, that is a typical paranoid personality characteristics. Then of course, schizoid personality disorder. Here the person is withdrawn type behavior, and some of the movies like old movies where that Ganeshan is doing, he is totally withdrawn type of behavior. Then dissocial behavior, antisocial. Most of the villains, you can remember, those are insensitive towards others' concern. All those features are specifically histrionic. You can get that female characters were so much attention seeking. You can remember some of these actresses in Malayalam films or any films. So if you associate some film characters with this type of personality disorder, it would be easy for you to remember. Then anancastic personality disorder. The typical example what I used to remember is the role played by Tilagan in Spadigam, Chakomash. This excellent character who is stubborn, strict with rules and regulations. So he is more concerned about laws. So that figure, that character is very much associated with this anancastic personality disorder. Then anxious personality disorder, the role played by Amala Paul in film Millie. It's a typical example of this anxious personality disorder. Then dependent personality disorder, like in Pondan Mada or in Vidayan. Vidayan is the exact film where the character played by the associate with Mammootty. Mammootty's helper, who is showing a totally dependent personality type behavior in that one. So if you can remember, if you can associate some of such film roles or film characters, it would be easy for you to remember this type. So that is according to ICD. Now we can move on to DSM. In DSM, these disorders are classified into three clusters: cluster A, cluster B, and cluster C. Cluster A is, to remember this cluster A, that is odd behaviors. Cluster B is emotionally unstable behaviors. Then last one is cluster C is, that is anxious group. So first cluster is odd clusters, second clusters is emotionally unstable clusters, third one is cluster C is anxious clusters. We can see one by one. In odd clusters, that is in cluster A, important types are paranoid personality, schizoid personality, schizotypal personality. We will, while discussing about the clinical features, we will explain each one in detail. In cluster B, that is emotionally unstable cluster, the types are antisocial personality, borderline personality, histrionic personality, and narcissistic personality. These are the personality disorder that is coming under cluster B. Now we can move on to cluster C, that is anxious personality group. In that comes dependent personality, avoidant personality, obsessive compulsive personality disorder, passive aggressive personality disorder. So these are the three important clusters according to DSM. So DSM classified this personality disorder into three clusters. Cluster A, that is odd behavior clusters. Cluster B, emotionally unstable clusters. Cluster C, anxious clusters. So we will see the clinical features of each clusters in detail. First one is paranoid. In paranoid personality disorder, the prominent feature we may get is suspiciousness. That is, the person may be suspicious in every aspect, every walks of life. He or she may be suspicious, and he may have that guarded nature. They will not disclose anything. Even if you ask anything, they will not disclose. They may show that guarded behavior. Then unemotional. They will not establish trusty relationship with anybody. Most of the time they will be self-centered, only concerned about them, only concerned about their rights, and they may not be that much interacting with others, and always they show some hidden meaning, hidden motives, hidden agenda in their life. They cannot be express themselves in all situations. Always they will keep some hidden aspects in their life. That is what is paranoid. These are the clinical features of paranoid personality disorder. Next one is schizoid personality disorder. The person is maybe cold, aloof, withdrawn, the indifference towards others' feeling. They are not concerned. They may be showing some coldness, always coldness, aloof. These are the features that we can see in individuals with a schizoid personality disorder. Next one is schizotypal. This is more associated with some of the symptoms. Along with that schizoid features, they may have some perceptual problems. They will be showing some magical thinking, abnormal thinking. So everything happens as a magic. Everything in their life is a magic. So they may consider everything under that heading, that is magical thinking. Always they may have perception problem. They may not be able to perceive as it is. Visual perception problem, hearing perception problem, all those things can be there in schizotypal. Next type is antisocial personality. The word itself, it is clear. The persons are irresponsible. They are showing lack of concern towards others and not able to maintain good relationship with others. They are always manipulative. That is very important. They may show some behaviors that is manipulative for their for their benefit. They will do, they will show, they will act whatever they want in order to gain their wish and wills. Antisocial, and they are showing no respect towards others. They are always law violators. They will not follow any law. They are aggressive. They are insensitive towards others' pain. So these are the features that we can see in antisocial personality. Next one is borderline personality disorder. Here it is identity diffusion. The person is not able to establish that identity, who they are. Always they are confused whether to belong to a particular group or this group, and mostly these people are intense and unable to establish good relationship with others, and they are always suicidal. And according to recent studies, we can see that among this adolescent suicide, major part of this adolescent suicide are associated with borderline personality disorder. So they are always problematic, they are suicidal, always showing that impulse behavior. They cannot control their impulse behavior. Impulsivity always shows that impulsivity. So that is the characteristics of persons with this borderline personality disorder. Next one is narcissistic personality disorder. From the word it is clear, they show self love. They are only concerned about themselves. They are grandiose. They need everything irrespective of what others feel. Everything they need, self-centered, self-love. So that is what is narcissistic personality disorder. Dependent personality disorder, the person is totally dependent on others. They cannot take any decision, they cannot solve any problems. They depend on others for everything in their life. So these are the features of dependent personality disorder. The next one is avoidant personality disorder. These people are the best procrastinators. They cannot take any decision, they cannot do anything. They will avoid anxiety producing situation. Real life situations they will not face because of anxiety, because of that perfectionism. They will not be able to complete any task, even they will not attempt any task. That is what is avoidant personality disorder. Next one is obsessive compulsive disorder. In obsessive compulsive disorder, from the word it is clear, they are always obsessed. The intruding thoughts are they are obsessed with these thoughts and images, and they will do certain compulsive act in order to overcome the anxiety associated with these obsessive thoughts. And they may have certain rituals, irrespective of the irrationality behind that rituals. They will perform that rituals, they cannot avoid that rituals. The last one is passive aggressive. That is very important group. That is, they are resistant to demands. They will not disclose anything. They will be silent maybe, but they are showing that aggressiveness through the silence. So they will not disclose anything. They are resistant towards others. They will not interact with others. They are even not concerned about others. So very difficult to assess such patients, such individuals with this passive aggressive type of personality. So that these are about different clusters and different clinical features associated with various personality disorders coming under these clusters. Now we can move on to management. Management is very important, and not only important, very difficult also, because it's a part of their making up. It's a part of their personality. When the personality trait is abnormal, we are calling it as personality disorder. It's a part of personality, very difficult to change. But there are possible techniques and possible ways to manage such conditions. First and foremost one is, of course, is pharmacotherapy, because individuals with personality disorder may have certain comorbidities, and this may have this mental illness, and because of this mental illness, person can show this personality trait or clinical features. So in that situation, it is better to treat, better to manage the comorbid conditions. Then we can very well control these symptoms. If the comorbid conditions are associated with micropsychotic symptoms, psychotic symptoms, schizophrenia like symptoms, BPAD symptoms, you need to manage that conditions. So typical treatment modality is atypical antipsychotics. Risperidone, olanzapines are the best drug of choice for individuals with these symptoms. Then of course, depending upon the anxiety, depending upon the depression, we can manage that conditions. Benzodiazepine, mood stabilizers can also be given, especially when patient is in suicidal ideation. Person is with a suicidal ideation, person is with self mutilation characters, anxiety, benzodiazepine is the drug of choice. Of course, sometimes it is mood stabilizers are also used, but it is considerably used less compared to atypical antipsychotics and anti-anxiety drugs. Next one is psychotherapy. Psychotherapy is very difficult. Some conditions individual psychotherapy is useful, and some situation behavioral therapy is useful. So what type of psychotherapy you need to um, employ depending upon the type of personality. Now next one is milieu therapy. Milieu therapy is very important. You may be very familiar with therapeutic community treatment modalities we visited in Navadarsana Gram, where people are treated for 21 days or 3 weeks or 3 months to modify their behavior. So major aspect, you may be remembering the major aspects in that therapeutic community, that is community meeting, regular community meeting, socializing, different techniques to improve socialization, group activity, peer support, psychoeducation and health education, problem solving skills. So all these has to be incorporated in this milieu therapy. So better to remember our visit to Navadarsana Gram Kattapana, where where sir was excellently explaining how they are doing these therapeutic community aspects in that particular setting. Now we are coming back to nursing diagnosis. So nursing diagnoses are mainly based on the clinical features. If the clinical features are anger, aggression or impulsivity, you can write risk for injury, ineffective coping, impaired family coping. So these are some of the nursing diagnoses in case of anger, aggression and impulsivity. If the person experiences crisis, it can be anxiety, ineffective coping, self-mutilation. These are the nursing diagnoses. If the person is with paranoid delusion, nursing diagnosis can be disturbed thought process and fear. If the person is showing withdrawn behavior, you can have social isolation as nursing diagnosis. If the person is showing depressive symptoms, you can have nursing diagnosis like low self-esteem, hopelessness, risk for suicide, self-mutilation, etc. So interventions depending upon the detailed assessment, you need to assess detail about the support available, various clinical features, previous coping skills. Depending upon all these things, you can plan and implement nursing care. So with that we are concluding. So personality disorder, you may get one short note. Usually we will get a short note. So you must be very familiar with this terminology. What is personality? What is personality trait? What is personality disorder? How these personality disorders are classified, that is ICD classification and DSM classification. DSM classification, ICD classification, it is F60.02. In DSM classification, it is cluster A, cluster B and cluster C. Cluster A is otherwise known as odd group of personality disorder. Cluster B is emotionally unstable group of personality disorder. Cluster C is of course anxious group of personality disorder. Then we discussed about definition of personality disorder, very important, that it is long lasting, enduring, pervasive, that is affecting that individual, onset during adulthood, early adulthood or adolescent period. It causes problem in like unhappiness and impairment. Then we discussed about the prevalence. It is prevalent, different personality disorder differently prevalent in males and females. Etiological factors we discussed. Then we discussed the clinical features of this personality disorder. Then we discussed about the management. In management, psychopharmacological managements are there. Then we discussed about the psychotherapy. Psychotherapy is very important and but cautiously employed depending upon the type of personality. Milieu therapy is very effective for improving their socialization and behavior. Then we discussed about various nursing diagnoses, and based on that we can very well manage this condition. This is very important for examination purpose. You may get one question from this area. If you have any doubt, you can mention that doubt in the comments, or you can directly contact. And with this we are ending. I will come with another video in next class. Thank you.